Basic ultrasound physics. For my disclosure, I am not an ultrasound machine technical specialist. This lecture does not endorse any particular ultrasound machine brand. Lectures will include only the basics in ultrasound-guided nerve blocks, and AI or artificial intelligence and advanced features of new ultrasound machines will not be discussed. Sources will be listed at the end of the lecture. My objectives at the end of this module, participants should be able to understand the basic ultrasound physics, to identify important functions of knobology, and to apply ultrasound physics in better nerve and needle visualization. So the ultrasound is a type of non-invasive image technology that uses high-frequency sound waves to create real-time images of inside our bodies. Sound waves are mechanical pressure waves measured as cycles per second or hertz. Your audible sound waves are 20 to 20,000 hertz. Ultrasound waves uses more than 20,000 hertz, while your diagnostic medical ultrasound uses more than 200,000 hertz. Ultrasound waves penetrate the tissues, which are then reflected back to create images. Ultrasound scanning is an interactive procedure involving the operator, the patient, and the ultrasound instruments. For the instruments, we have the transducer, which is a device that sends out and receives sound waves. Then we have the machine, which receives the echoes from the transducer and converts sound waves into images of different shades of gray. There are several types of transducers, but for ultrasound-guided nerve blocks, we usually use either the linear array or the curved array probe. The linear probes are high-frequency probes using sound waves of 5 to 17 megahertz, while curved probes are low-frequency probes using sound waves of only 2 to 5 megahertz. For knobology, the knobs we should know are the following. First, how to turn on your machine. Then the patient scan details where you input the name, the hospital number of the patient, the scan details, and the date of the scan. When you are ready to scan, find the transducer button to choose which probe to use, either the high-frequency linear probe or the low-frequency curved probe. Most ultrasounds have pre-scan settings. You could choose presets to scan nerves, muscles, small parts, abdominal, or among others. The mode we use in ultrasound-guided blocks is the B mode, and the color Doppler is also useful if we want to scan the vessels. The depth button can improve image resolution by shortening the distance of sound wave reflection. The gain button controls overall brightness. Time gain compensation is brightness control in specific parts of the image. Focus button allows for best spatial resolution by concentrating the sound wave to the target structure. Freeze button allows for image frame acquisition, useful for discussion purposes or documentation. And lastly, we could use the caliper to measure the distance between needle entry to the target structure. So let's get back to sound waves. Sound is a measure of wavelength and frequency. Wavelength is the distance from peak to peak in a wave. Frequency is the cycles or waveforms per second. The shorter waveforms have shorter distance of waves from peak to peak, hence more waveforms per second or high frequency. Larger waveforms have longer distance of waves from peak to peak, hence less waveforms per second or low frequency. So this is an example of how your sound waves get transmitted into tissues. The gray area in this figure represents the tissue. The white waveforms are your sound waves. The red lines represent sound waves that are reflected back to the transducer to create an image. If you use a high-frequency probe like your linear probe, you have shorter waveforms which allows more waves per second and more cuts in the tissues to create an image. The more image cuts, the higher resolution or clearer image. But due to the high number of waveforms per second, energy attenuates faster, hence limited length of sound wave travel. or poor penetration. Unlike in low-frequency probes like your curved probe, larger waveforms allow less waves per second or less tissue cuts to create poorer image or low resolution. But because of the lower or fewer number of waveforms per second, energy doesn't attenuate as much. Hence, it can penetrate deeper structures. For the echo principle, or how image is created by sound waves, we use the piezoelectric effect, which is the ability of certain materials like crystals found inside our transducers to create images from an electric charge in response to applied mechanical stress, or your sound wave. Electricity is introduced to your transducer, which contains piezoelectric crystals. These crystals vibrate to create mechanical pressure or sound waves. Sound waves penetrate the tissues and gets reflected back to the transducer, in which the crystals again vibrate to create energy that can be converted into an image. Your echo range principle is the speed of sound that can determine depth. Basically, the time sound waves gets reflected back from the tissue to the transducer can be converted into a measure of distance. The longer the sound travels, the deeper the structure. Brightness of the image is a function of ultrasound waves that are reflected back to the transducer. Waves are reflected back to the transducer from the interface of tissues with different physical properties. Position of the structure in the screen is a function of how long it takes the wave to return to the transducer. The longer the sound travel, the deeper the structure. So the more superficial the structures, it will appear at the top of the image, and the deeper the structure, it will appear at the bottom of the image. Echogenicity is the amplitude and the brightness of the image. We call structures hyperechoic if it is more bright than the surrounding tissues and they appear white. Hypoechoic structures are structures which are less bright than the surrounding tissues and they appear black. Isoechoic structures have the same brightness as the surrounding tissues and they can appear gray. Nerves may appear hyper or hypoechoic depending on the amount of surrounding connective tissues. For example, your nerve roots in the interscalene scan will appear black or hypoechoic as it is nearer to the central nervous system as compared to a more peripheral nerve like your sciatic nerve, which will appear white or hyperechoic. Speed of sound is a measure of density, wave propagation, and speed, and measured in meters per second. To compare, air has 330 meters per second, bone has a speed of sound of 4,030 meters per second, and tissue has a speed of sound of 1,040 meters per second, which is the default speed of sound used in our ultrasounds. Acoustic impedance is the resistance to the propagation of sound or the ability to reflect the sound wave. This depends on the density and the velocity of the sound measured in megareals. To compare, air has 0.0004 megareals, adipose has 1.38 megareals, water has 1.43 megareals, soft tissue has 1.69 megareals, and bone has the highest acoustic impedance has 7.8 megareals. The higher the impedance, the more sound waves are reflected back to the transducer, and the more the image will appear white. So many factors affect the amount of reflected sound waves that also affects image quality. The most common factors that weaken sound waves are the following. So we have attenuation, in which sound waves weaken as it travels back and forth into more tissues. We have scattering, which occurs when sound waves strike structures with different acoustic impedances. And we have absorption, in which the process of converting vibrational energy into heat. So again, the ultrasound mode that we use is the brightness or the grayscale mode. There are several other modes like your amplitude, motion mode, and your Doppler mode, but we will not be discussing this in this lecture. In the B mode, images are the two-dimensional cross-section of structures depending on the plane or axis of the transducer. So we can create two-dimensional images in the coronal plane, transverse plane, or the sagittal plane. For orientation, in this figure, we place the transducer on the right thigh of the patient in a transverse plane. Transducers have markings, which designates to which side of the image. In this case, since the mark is on the lateral side of the thigh, the image will be oriented as lateral side of the right thigh on the left and the medial side of the right thigh on the right part of the image. For eggshell resolution, we follow the following concepts: that sound waves travel in a straight line. Hence, ultrasound transducer must be placed perpendicular to the target structure to visualize it clearly. The more perpendicular your needle is to the beam of the transducer, the more you can see the whole needle in the in-plane approach. As you can see in this figure, for the linear probe, the beams of the transducer travel in the same downward direction. Hence, if you place your needle perpendicular to the transducer, all sound waves will be reflected back to create an image of the whole needle. For your curved probe, the beams of the transducer travel in an angle. So placing your needle perpendicular to the probe will result to some loss of sound waves reflection, creating a poorer image of the whole needle. In contrast, if you put your needle in an angle, for the linear probe, the bigger the angle of the needle entry, the more sound wave reflection will be lost, hence poorer needle visualization. But for the curved probe, since transducer beams are transmitted in an angle, there will be better sound wave reflection in similarly angulated needle entry, hence creating a better needle visualization. To create the best transducer to needle sound wave reflection, you could utilize some transducer manipulation to create the optimal nerve or needle visualization. You can do sliding, rocking, sweeping, fanning, compression, or rotation. The key is to get the best angle of sound wave reflection. Remember that ultrasound images are only interpretations of sound waves, hence, there can be some artifacts. And we will be discussing the most common artifacts. So one artifact would be your inadequate conduction or poor contact. So as you can see in this image, there is no reflection from the top of the screen because no sound wave was propagated. So to resolve this, you could increase tissue contact or add your conduction medium. Next, we have shadowing. This is caused by high attenuation and high acoustic impedance. We see this when sound waves hit bones, which has high acoustic impedance, in which sound waves cannot travel through it. So we see a bright white structure followed by black, which meant no sound wave was reflected after the bone. Next is acoustic enhancement. So this is caused by low attenuation and low acoustic impedance. We see this in liquid-filled vessels. Liquid has low acoustic impedance than tissue. The tissue below it will appear white because of higher acoustic impedance. We sometimes misidentify these structures as nerves. And lastly, we have reverberation, which is caused by acoustic impedance mismatch. This can be seen when we have poor contact or the transducer is misaligned. So some take-home notes. Ultrasound scanning is an interactive procedure, hence it is operator dependent and greatly influenced by patient variations and machine capabilities. Understanding how sound waves will produce an image will help in nerve and needle visualization. Manipulation of your transducer to improve the axis of sound waves as it hits your nerve or needle will improve image quality. Ultrasound images are interpretations of sound wave reflections, hence it is still prone to some artifacts. So these are my sources. Thank you.